Welcome to the National Patient and Family Engagement Learning and Action Network Kidney Caregiver Peer Connection Call. We appreciate your interest in this topic. Today's call is meant to be an informal way for caregivers to ask questions of other caregivers and patients who have experience with the kidney disease journey. Before we get started, there are a few items we'd like you to remember. All the lines are currently muted. The lines will be unmuted after we introduce our panel of caregivers. Please be respectful when asking questions and do not speak over someone else. We also ask you to take the call in a quiet location and mute your line when you are not speaking. This call is being recorded and will be made public on the NCC website. We will also promote it on social media. Please do not disclose any personal identifiable information. Do not share any information that you would not want to make public, such as your date of birth or the name of your dialysis facility. Please do not ask for medical advice. The role of the panelists is to share their personal experiences of caring for someone with kidney disease. If medical advice is asked or given, the NCC will interject in the conversation. Each person's situation and experience is unique. The treatment plan for each patient is unique to their personal needs and various factors, including other medical conditions. Before making changes to your health practices, speak with a member of your healthcare team. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding medical conditions. The views and opinions expressed during this call are those of the panelists and do not necessarily reflect the official policy or position of the ESRD NCC or the Centers for Medicare and Medicaid Services. Any content provided by the panelists is of their opinions and is not intended to substitute for professional medical advice, diagnoses, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding medical conditions.
Kim Bittner, and you previously heard from Jerome Bailey. We work with a group of patients with end-stage renal disease and their caregivers to design and spread practical approaches that can be used to help other patients become engaged in their health and care to improve their quality of life. We have selected a group of 3 subject matter experts from the LAN group to answer your questions and share their individual experiences. We would like to thank them for agreeing to join us today, and you'll see them on the slide. So we have Charlene Johnson from Iowa, who's been a caregiver to her son, Natasha Bress from North Carolina, who's a care partner to her husband, and Olga Hernandez-Perez from California, who's a care partner and also donated a kidney to her husband. So what we will do now, I'd like to take some time so that they can introduce themselves to you, but they are in the call list. So we're going to unmute all the lines, but I would like just Charlene, Natasha, and Olga to let us know that they are on the line with us. So Jerome's going to unmute the lines. Charlene?
I'm on the line.
And Natasha?
Yes, I'm here.
And Natasha. And Olga?
Yes, I'm here.
Okay. So now we're going to, can we mute the other lines?
Not just yet, Kim, but go ahead.
Okay. Okay. So, Olga, let's start with you. Can you tell us what a day in your life looks like for you as a caregiver?
Sure. Now that my husband has had his transplant, of course, it's a little bit different than before. However, I'm gonna, kind of go by when he was going through his dialysis. A day basically looked like when he first started with dialysis, he was going through peritoneal dialysis, and peritoneal dialysis is mostly done at home, of course, which is a little different than hemo. So he would connect every night, let's say like around 7 or 8 at night, because the machine had to go through a 10-hour process, and he chose to do it at night because he still wanted to go ahead and work. He was aware that his doctor could put him on disability at any point when he felt that he needed to be on disability, but my husband chose to work, and thankfully his job, kind of accommodated him a little bit as well. So basically, every day, we really had to be home, whether it was Saturday or Sunday. We had to be home at least by 7, the latest, so that he can connect no later than 8 o'clock. Then he will disconnect like around 6 in the morning, and on weekdays, that would allow him time to get ready to go to work. And disconnecting meant that, we would have to clean our hands, sanitize our hands, put masks on. And if, let's say, it was summertime and the AC or a fan was on, we had to turn off ACs or fans for at least 15 minutes prior to starting the process of disconnecting, just in case there were any particles in the air that would, eventually might cause an infection of some sort. So that was every morning. Aside from that, of course, since he had high blood pressure and diabetes, that complicated a little bit for him, because sometimes he would, his system was just out of whack all the time. And so sometimes every morning was not a smooth morning. It wasn't just connecting and let's go to work. Sometimes he would feel ill. Sometimes, he felt like vomiting, and sometimes he would vomit. And so, that wasn't a smooth morning every day going into work for him or for I. So, that was a little bit of a stress there. So that was kind of like our everyday routine. And then, of course, making sure that he ate and took the meds that he needed to take throughout the day as well. Once he started going to hemodialysis, because he eventually did go to hemodialysis because he did, in fact, got an infection in his peritoneal connection. So when he went to hemodialysis, it was 3 times a week, which at first it did feel a little bit differently than him connecting every night. But that brought other things along with that as well. He was more on a fluid restriction. And for some reason, my husband was I'm sure each patient is different, of course. Every time he would be on fluid overload, which was, it's not like he drank a lot of too much liquid, but for some reason his body, any little bit of more than what he should have taken would cause him to overload. And for some reason, the liquid would go to his lungs. I know that there have been other patients that he spoke to that maybe perhaps their legs would get swollen or their hands, but for him, it would go straight to his lungs, which would be horrible because he felt that he couldn't breathe, like he was drowning. So we went to the ER very, very frequently, especially in between treatments, because he just couldn't breathe. And so that caused, again, some absentees from work, or just a routine. We couldn't really hold a routine sometimes. So that was a little hectic as well. So that was kind of like our everyday routine as a caregiver, making sure that I was there for him and ensure that he had what he needed. And if he couldn't think for himself at that moment because he wasn't feeling well, I had to make sure that I was on top of things and make sure that, okay, I need to do this and to that and to take his meds. If we went to the ER, I needed to take everything with us because I knew the doctors were going to ask me, what is he on? What is he taking? So it was just basically always trying to be on top of things and trying to remember everything he needed to have or do to make sure that he was okay.
Thank you, Olga. Olga, you mentioned multiple facets as far as with your husband and his different treatments, as well as the different roles that you played depending upon what his needs were. So thank you very much for sharing all that. We appreciate that. Charlene, and with your role as a caregiver, what does a day in the life look like for you as a caregiver?
My life completely changed. I was still working in the emergency room and also as a nursing supervisor at the time. And when I retired, then I started helping in Mark's restaurant, my son's restaurant. And so it completely took all my time. I had to, surrender all the activities that I had been and that I had been doing. and I was very active in the community services, and I had to stop all that. Plus, I had 4 other children in other states, and it became a problem because I could never travel to see them, and it caused some hard feelings. Also, I had to be there every day. We did it for 5 hours every day but Sunday, and once in a while I would take off Wednesday. Mark had a lot of problem with fluid overload, like what Natasha was saying. But we finally got that under control. And he was also very depressed when it started, so we had to really work with that. Depression is one of the first things that I noticed when Mark had to go on dialysis. Also, if we had any problems, I would not be able to take him to our emergency room here. They were not equipped, so we'd have to travel nearly 100 miles to go to a hospital. So when he was really, really sick, it caused a lot of problems. His lab work would just be all out of kilter by the time we would get to the through the emergency room and into a room in Des Moines. And other than that, I think it was worst was, since I was the mother, it was the emotional part. It was really hard to see some of the things that he had to go through. We had been told by the nephrologist that he had only 6 months to live if I didn't do the dialysis. So that was one thing I went ahead and said immediately, yes, I would do. And so I had 7 days of training. But they never got into the emotional. They never got into how much time this is going to take. So it was an eye-opener once I got started, because I finally had to close the restaurant because Mark was unable to even do spreadsheets. So it became, so really I had to grieve over some of that, and he was grieving over it. So it caused a lot of emotional problems while we were going through it. And finally we worked through all of it, and we became a lot closer, I'll tell you that. But again, I never got to see my other children. But I'm glad I did it. I am so glad I did it.
Thank you so much, Charlene, for sharing that. I mean, you really talked about the changes, responsibilities, the emotional impact. Definitely appreciate you sharing that with us today. Natasha, would you like to share with us what a day in the life looks like for you as a caregiver?
Sure. So me and my husband, we've been together for 8 years, and he's been on dialysis for 9. So when we started dating, he had already kind of had the system set up. So I kind of came in just new to all of this. Honestly, I didn't really have a big part in his dialysis to begin with, again, because we were just dating. He started in-center and then went to nocturnal, PD, and now he's on home hemo. I had a little bit of information before finding out he was on dialysis. I have a cousin who has had multiple transplants and been on dialysis home and in-center, so it wasn't foreign to me. My husband's also very self-sufficient. Like he's really big on doing things himself. He doesn't require a lot from me, and I think that's a lot to do with the fact that he didn't want to have to, in his mind, burden me with it. So he kind of kept to himself with his dialysis and kind of getting set up. He doesn't tend to need me that much for it. Even though I am there, I have trained, I am kind of there to back up if he needs anything. Our day really just looks like, now with him doing home hemo, he wakes up about 5, 6 in the morning to start. He gets himself on, set up. Usually around 8 o'clock I get up for work. I check in on him to see if he needs anything, just to make sure everything's functioning well. I live where I work. I'm a property manager, so I walk to work, and if he needs help getting off of treatment, he'll call me about 10 minutes before to come back. But usually he can take himself off as well with no issues. So it really is just, again, he's real self-sufficient, and he is like to give me as much information as possible. I think in regards to our kind of caregiving partner relationship, I think the emotional burden that comes with it, you know, you don't really hear too much about that. I think starting and doing everything, it's a lot to take on, and kind of figuring out your relationship while being a caregiver as well, and that communication and what that looks like throughout your time together.
Thank you, Natasha. Definitely appreciate you sharing all that, both with the past experience, the adjustments that you've made, and with figuring out with your relationship too. That's all helpful information. And for all three of you, thank you for sharing what you shared with just that one question. I'm sure everyone on the call can relate to something that you said and probably has questions. So now we'll get to the part that is the most interesting, where everyone can ask questions. All the lines are already open. So if you do have a question, we're going to try to do this where everyone can ask a question. We'll try to take them one at a time, and we'll try to manage any background noise. If you are on the WebEx, you can also submit a question, and we will try to answer them that way as well. So does anyone have a question for any of our panelists?
No questions.
Any questions?
I have a question.
You can. Go ahead.
Okay. Yes, go ahead.
This is Judy. You all mentioned about the emotional and the emotional part. So how did you deal with it? How did, between you and the person you were caring for, were you able to deal with those things?
Can I go ahead and answer that? This is Charlene. How I dealt with it, I did speak with our minister frequently, and also one of my daughters who is a missionary, I spoke with her. So that's how I got through it. And finally, I had to really sit down and talk to Mark about just what I was going through so he would understand some of the problems that it was causing them.
Hello? Yes? This is Olga. The way I think I got through this was first, my faith in God, of course, and knowing that I had my family there. My family, from my side, would always, and his side as well, would always reach out and just ask me how I was doing. That helped. On a personal level, by myself, I think one way that I was able to get through it was just having that connection or that moment for myself where I would, kind of do my daily prayers. On the other hand as well, one way that helped me was that I did come to a point where I was feeling a lot of anxiety and a lot of stress. And for me, one of the things that has always released a lot of my stress, in any other situation has been exercise. And for a while, I stopped exercising, because there were so many other things that were happening that I didn't make time for me. And that was every time I would exercise in any other part of my life, exercising is like me time. And I think I did forget for a while to give me my me time. And for me, going back to exercise, specifically for me was Zumba. I quickly looked for a local class. And I think that when I started giving myself at least 2-3 hours a week, of Zumba, that helped me to release a lot of anxiety because that was kind of like my time. And it's not because, of course, I wanted to get away from my husband. It was just that I needed some time for just to focus on me at that moment. So I think that helped me a lot emotionally and deal a lot with my anxiety and stress, exercising. And the other thing was when, of course, the patient goes through their own process as well. So my husband was going through his own process. But when he was able to and he was ready to talk a little more about it, we did go to therapy together. And that, I think, also helped both of us and helped him and helped me to talk to a therapist of what was happening. But that was, when we were able to get to that point, I think that was more towards the end when he was close to getting a transplant. But nevertheless, we did go. So I think those different aspects were the ones that helped me get through, the process of being a caregiver.
Thank you, Olga. Did you want to add anything to that, Natasha?
We just kept our communication lines very open and honest. We also did couples counseling as well, just to help give us like a mediator, a middle ground person, just to keep that communication open. And he answered any questions I had about anything, and he was always willing and understanding of kind of what that was for me as a care partner. So just going to therapy has really helped me. I see a therapist myself, and he does as well.
Hey, Kim, we got in a couple of questions from in the chat box that I would like to pose to the panelists. The first one is, what do you wish you knew prior to starting this dialysis kidney disease journey?
This is Charlene. I wish I would have known just how much time it was going to take. And nobody ever spoke about the emotional. Nobody ever spoke about how long I would have to be doing this. It became quite, evident that I was sort of on my own, because we were way out here, quite a ways away from Des Moines, where I could get some help from one of the nurses there. I really had a lot of questions, especially when starting buttonholes, and that I had nobody to help me with any of that. So it became just a little bit of a problem. One thing, my children, the other children, did not understand dialysis. So what I did one day was take pictures of what I was doing, of what Mark's arm and that looked like, and then explained, and that did help a little bit. So they understood why Mark was needing it and why it was taking me away from them. And so it became better. It became a lot better.
No.
Thank you, Charlene.
Hello.
Yeah. Oh.
Yes.
This is Olga again. I think one of the things that I wished I would have known, or I wish there was, I suppose, and we could say it that way, is, as the other person mentioned, I wish or I hope that there's some type of emotional support group or focus group for caregivers, because I think at this point, I don't think I'm not sure there is any in any centers. I mean, not that I'm aware of, but I think having some type of group or some type of organization that can be known to caregivers and say, hey, you're about to start this process. We do have this support group. Please reach out to us, and we are here specifically for you, the caregiver. There's a lot of other support, and there's obviously the physical help for the patient. But I think that caregivers are often not purposely forgotten, of course. It's just that and I completely understand that the patient is the patient, and they are the important ones in terms of making sure that their physical health and their emotional health is better. But I think that I wish there was some type of support group for caregivers to know that you are being supported as well, in a different way, of course. So that I hope that maybe one day there could be some, or maybe there is, and I'm not aware of it at this time.
Feedback. Thank you, Olga.
This is Natasha.
Hi, Natasha.
Sorry. I didn't really have too much to add. What Olga said is pretty much what I was going to say. Just the need for emotional support for the caregiver as well. I think in my situation, I try so hard to be strong for my husband and make sure I'm keeping a brave face. But sometimes a lot of this stuff is scary to me and new to me. and it's a lot of times overwhelming, and having that support as well for us, like Olga said, in a different way would be helpful.
Excellent. Thank you for sharing that, Natasha. Do we have any questions? Does anyone are there any other questions?
Yes, my husband has been receiving dialysis for 2.5 years or so. And for some reason, he just dreads going every time. And I have tried every way to understand and try to talk him out of it. And I don't know, he just is obsessed with the whole situation and the fact that he never really accepted the fact that he needs it. And it's a large commitment of time. I mean, everyone knows that. And it's a difficult, the chair time is stressful and difficult. He does watch a lot of movies. I mean, we've tried to do everything to get him entertained. I used to sit with him every time he had, for the first probably year and a half, I would stay with him.
Yes. Okay, well, listen,
Are you still there?
I gotta go. Okay.
Hello?
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 Tony?
Mhm.
Did we lose Tony, maybe?
Yes, this is Tony Good.
Mhm.
Okay. Did you want to finish your question?
I don't know. Was I cut off? Because I thought I just finished now. I just asked if anybody had any suggestions.
Okay, sorry, there's a little background noise. There's just a little background noise. So, Olga, Natasha, Charlene, do you have any feedback regarding her husband and it sounds like as a caregiver, how do you work with your loved one and the anxiety of going to treatment?
Mm-hmm. That was basically the question. Thank you for the recap. This is Tony again.
Oh, you're welcome. You're welcome.
Oh, this is Charlene. You know, I've never had that kind of a problem, but have you ever entertained doing home dialysis? Would that possibly be better for him? Maybe you better look into something like that. It would be difficult if you had to fight with him every time. I feel sorry for you.
I know. It's not that we fight over it, but it's just that he's so distressed. I mean, the morning, his session starts around noon, and he's just out of sorts the whole morning. I mean, he ruined so much time that he could do something else. And
does a social worker help you at all?
I think we've talked about this, but I mean, it's almost I've never made it clear how long and how intense it is. Maybe if I did, because a lot of people, I mean, I don't think anyone really likes to go in and have the session. I mean, very few people, I know some people have a camaraderie or they feel the companionship or sharing their situation with other patients in the room, but my husband doesn't really. But actually, the funniest thing, when we do get there, he's all smiles and he doesn't want to let anyone know that he has this. I think it's more of an anger than anything else. He's just angry that this happened to him, and he's just hard to accept it. But when he does get there, I mean, he's very cordial. People think he's a lovely man, which he is. But it's just kind of a crazy thing. And maybe I just get the brunt of it. And I know I've heard many times that caregivers are the safe people. They can take all the slings and arrows from someone that needs to unload. So maybe that's all it is. Tony. And I try not to take it to heart, but I wish I could help him or make a suggestion. And about the home dialysis, he really does not want anything to do with that. He much prefers going into the center, and he has had a lot of medical issues. We retired about
Tony.
8 years. Yes.
Tony, I'm sorry. May I interrupt? You brought up a lot of good points from the caregiver perspective. And so if you don't mind, I'd like to pose a question to the panel that might help you from the, the caregiver perspective, because it sounds like, you'd like some kind of feedback from other caregivers on how to, maybe manage or cope with.
Yeah, I would love that.
Some of these experiences. So, Charlene, Natasha, Olga, have you ever, in what you've been experiencing with as caregivers, ever been in a situation dealing with, frustration of not being able to, what's the word? Maybe, where it's very overwhelming with everything that's going on, and not being able to completely control the situation and help your loved one and provide the assistance that you would like to be able to provide, because there are so many other factors that are involved. Maybe it's when going to a doctor's appointment or getting ready to prepare for an upcoming appointment, and you just kind of feel at a loss and not know how to assist. Have you ever been in a situation like that you could provide maybe some tips for Tony?
Hello, this is Olga. A situation, not in the same way, of course, a situation that sometimes I would find myself with my husband was that when he was doing peritoneal dialysis, and he would have it, he would have the process all night, like from 8 until 6 in the morning. For those of you who may not be too familiar with peritoneal dialysis, I mean, it's his belly would get filled up with liquid, stay there for 2 hours, clean him out, and then through the tubing, through his stomach, the water would drain out, and then it would go back in. So he would have that done several times throughout the night. In theory, you should be sleeping while that's being done, but, in actuality, it's a different story. Sometimes he would sleep, sometimes he wouldn't sleep. And sometimes there were days, maybe 2 days in a row, that he wouldn't sleep, really. And in those days, I think that's when, tired, not feeling well, and not being able to sleep, the worst would come out of him, and there were few times, but there were very few moments when, I remember that, he would tell me, how long am I going to have to go through this? How long do I have to, can I sustain this? I would rather not live anymore. And so those words hit me hard. And that's when I felt, how do I answer to that? How do I get him out of that state of mind? It was impactful for me to hear those words from my husband. And then, so it's affecting me in my own way. But then I also had to think, okay, how do I help him at 3 in the morning when he's telling me these things? How do I help him get out of those thoughts and know everything will be fine? How do I make sure that he knows that? And of course, at the same time, how do I know that things will be okay, right? Because nobody knows the future. So the only thing that I can tell you, or that I can suggest to you that I would do, is basically not stop talking to him. Continue talking to him, like not leave him alone in his thoughts, because I think that's one of the worst things that can happen to us as humans, when we're alone in our thoughts and we kind of dwell on whatever it is that we're thinking. That's the worst right there. And I think that one of the things that I kept doing with him was just always talking to him, letting him know, okay, I can acknowledge his feelings at that time, of course, but letting him know, you are going to move from this. We are going to move from this. You're not going to be like this in this particular situation forever. And I think keeping that dialogue with him, not to say that my words were always effective, but just the fact that we were talking, I think that made a big difference in many of the times. Again, not leaving him alone in his thoughts, or leaving myself also alone in my own thoughts, which that also is not as well as the caregiver. So I think trying your best to keep talking to him, and to keep asking questions. Why do you feel this way? Is there anything that I can help you with to make maybe your visit that's coming up to the dialysis center a little better. And I know I'm not giving you a straightforward answer, of course, but that kind of works for me, just kind of keeping those dialogues, those communication lines open, I guess.
Well, that's all good advice, and I try to follow those things, but I think we always can do better. I mean, that's certainly communication. I think is an answer for many, many things. It's just that I do feel so badly that he has the same feelings for so long. The dread of going in. It's just part of his life, and it's an acceptance problem with him.
Tony, I do think that's something that Charlene had brought up to definitely discuss this with your social worker. It does sound like this is something that you should discuss with your social worker and seek that assistance there as well. And thank you, Olga, for giving those tips. We do appreciate that.
Can I add one thing? This is Charlene. Tony, have you ever, do you know of anybody else on dialysis that can speak to him that he might listen to? Another man. A good
suggestion. That's a good suggestion there, Charlene. We have heard about that before with, peer mentoring. So definitely when you talk to your social worker, see if that's something that they recommend at their facility as well, or if it's something that they offer there as well. So definitely thank you for that suggestion. And did I hear Jerome?
Yeah,
did I hear
Kim, we got another question. We got another question into the chat box. And this person is asking, what do you do to decompress from the stress of caregiving? So can we hear from Natasha? Natasha, what do you do to decompress from the stress from caregiving?
I just try to make sure that I have kind of my own time away from everything, and that may include my husband, may not. It just really depends. I also try to make sure that I have my own safe space. So, like I said, I have my own therapist that I see once a week, not just in regards to being a caregiver or anything like that, but it's just nice to be able to talk to someone just in regards to everything else that might be going on in my life. I also do try meditation in the morning and at night. But I suffer from anxiety and things like that. So a lot of the times when things get overwhelming in regards to my husband's health or what needs to be done, I get really stressed out. So I definitely have to take time away to be able to pull myself together to be that person that he needs. But again, my husband is very amazing and has a great spirit. He's always for 95% of the time has a good attitude about dialysis and everything. He is that person that other people talk to get explanations of what's going on. He's not shy about it. He thinks this is just another part of his life, and he continues to live his life to the fullest. And so he definitely helps with that, to help me not feel as stressed out about everything, for sure.
And Olga, you?
Yeah, I'm here.
Okay.
I think that one of the things that I first, when I guess became his caregiver, I didn't realize this. So it took some time for me to kind of realize that I did need my me time, as I mentioned before. When my husband was diagnosed, and we realized, okay, dialysis is something that is going to hit us, and he will have to have this done. I didn't think of, how I'm going to take care of me. I completely put that off to the side. So it took a while for me to come to that understanding, okay, I do need my me time because I have to, otherwise I won't be able to be myself and then be the best that I can be for him. so like I mentioned before, exercising for me, that was it was my thing, that I needed to have that time for me to kind of decompress. Also, something as simple as maybe watering the garden and just spending that few time again with me, myself, was very important. And also, having conversations with my husband that did not have to do with his dialysis and talking about, let's say, the future, I think that also helped me and helped him, knowing that even though he's on dialysis and that's our reality of right now, we can do other things in our lives as long as we adjust. And again, at first, we perhaps didn't think that way, but I think knowing that even though he was on dialysis, we could still go, here and there. But of course, there were just modifications that we needed to make and ensure that he would get what he needed to be, healthy and to be safe. So I think my me time, and then also just knowing that there was life continues, and it wasn't just all about dialysis. But of course, keeping that in mind that he had to have that done to be able to survive, but to understand that we could still have our so-called as much as regular life as we could, and enjoy ourselves with modification.
Thank you for sharing that, Olga. We appreciate that. Do we have any other questions?
Can I ask a question?
Sure.
Hi, this is Kim Pratt from Rhode Island. I think it's Tony. Are you the one that the husband does not want to go to dialysis? Am I correct?
There was someone who asked that question, correct?
Yeah. What I was wanting to know, if that patient, that gentleman, if he's able to do any walking or exercise before his noon dialysis treatment, that maybe could get his mind clear, or just some kind of activity to get his mind off of the anticipation of going to dialysis treatment. I was just curious if he was physically able to do something like that.
Oh, so that's so you're offering a suggestion to one of the callers of exercise, which I think is something that Olga had also suggested as a caregiver. That's a good kind of stress reliever. It's a good idea. Thank you for sharing that.
Yeah, I used to do that all the time before dialysis, and my time at dialysis gave me the morning, the early part to do that, and that really helped me. Is to, we have a seawall to walk at. There was parks. I would walk in different places, or even inside at the physical therapy clinic across the hall from dialysis. But really, that helped me a lot. Helps clear you and just help you to not quite be so engulfed with the feelings of being a patient.
Well, I appreciate you bringing that up, and I think that's definitely one of the things that was discussed here as well by our caregiver panel about the importance of stress relief and how to kind of take care of yourself. And I think you demonstrated there that can be used for both caregivers and patients. So thank you for doing that.
Yeah, both. I agree with both, yes.
All
So,
right.
Kim, we received another question in the chat box. And the question is, do you have any experience with asking for respite care help? And if it's yes, was it helpful? Charlene, we'll start with you.
That was one thing I wished I could have had. There was absolutely no one here that would be able to take over for me. And when my husband passed away, then of course Mark went back up to the unit and again was treated very badly. So that didn't help any. So it was pretty much just him and I practically every day of the week. But it would be nice if we would have a way to have respite care.
Natasha?
Yes. Hi. I've never really had to, use it, use any respite. Again, he's really self-sufficient with everything. But we do have really great friends that if he's had a bad day and I had a bad day not able to cook, they brought food, they brought meals, they tell us come and check in on us. So we have great friends who are very involved in our lives. In regards to his treatment, they check in. If I need someone to go with him to an appointment, instead, if I can't miss work, they will definitely be available, any of our friends. We have a nice tight-knit group of people who we have a chat with, and if I need anything, they're there. So I thankfully don't have to worry too much about that. But I haven't really needed to use it. We definitely have more, I guess, good days than not. But if I ever do need a break or think I do, they're definitely there. Or even if we both need just something to take our minds off of everything, we have great friends for that.
Okay. And what about you, Olga?
No, I haven't had any direct experience or with that, so I wouldn't have anything to share.
Okay, thank you.
Thanks for that question, Jerome, and thanks for whoever submitted that. Do we have anyone else who's called in that has a question that would like to ask our panelists a question? All right. Well, it looks like we don't have any more questions for those who are on the call, and we've gone through the chat questions. So thank you, everyone who has asked questions, and thank you for this dialogue and sharing. We do appreciate it. We know that now in this environment, sharing is definitely appreciated and more important than ever. I think we touched on a lot of topics and definitely realized that we have a lot in common as far as with being caregivers and care partners. So thank you, Charlene, Natasha, and Olga for sharing a little piece of yourselves and your experience with all of us. We really do appreciate it. It does make an impact.
Thank you for having me.
Well, thank you. I appreciate it.
Thank you.
All right. So for more information on caregiving options, please visit any of the websites listed on the screen. The websites include the ESRD NCC.org/NPFE-LAN website, the American Association of Retired Persons, AARP, Family Caregiving website, the Caregiver Action Network at caregiveraction.org, the ESRD Rockstars, that's ESRDRockstars.com, the Family Caregiver Alliance, and that's at caregiver.org, or the National PACE Association, which is npaonline.org. There are several ways to contact the ESRD NCC. Our email address is nccinfo@hsag. Our telephone number is 844-478-4250. Our address is there on the screen. We also invite you to follow us on social media. You can find us on Facebook by liking ESRD National Coordinating Center, or follow us on Twitter at ESRD NCC. And we are also on YouTube. You can search ESRD NCC. Thank you all for joining us. Have a good day.
hospice said that